Good afternoon, and thank you for joining me today. My name is Adam Gunther, and I am a Senior Account Service Representative at Blue Shield of California. In this presentation, I will be going over, at a high level, the Access Plus and Trio HMO plans, some differences between the two, and additional programs available to SFHSS members in 2024. SFHSS members have the option between two HMO plans, the Access Plus or the Trio plan. The Access Plus and Trio plan benefits remain the same from 2023 to 2024. Both are HMO plans which require you to choose a personal care physician or PCP. These PCPs are associated with an Independent Physician Association or IPA, often referred to as a medical group. Members must stay within their chosen IPA for all services. Both Access Plus and Trio plans are copay driven. The benefits for both the Access Plus and Trio plans are the same, with the network being the main difference between the two. The Trio network is a subset of the Access Plus network and is only available in select regions of California, whereas the Access Plus network is Blue Shield's full HMO network and is available throughout California. Members may self-refer to a specialist within the same IPA as their PCP. If you self-refer to a specialist outside of your assigned IPA, you will be responsible for 100% of the charges. Shield Concierge is available on both plans. As always, we encourage you to go for your preventive services, which are available at a $0 copay within your assigned IPA. If you have any preventative services outside your IPA, you will be responsible for 100% of the charges. Taking a high-level look at the benefits for the Access Plus and Trio plans, you'll see the benefits are the same. As I advised on the previous slide, the benefits are the same for both plans, with the network being the main difference between the two. Both have no deductible with an out-of-pocket maximum of $2,000 individual and $4,000 family. Both have a $25 copay for PCP visits, $30 copay for specialist visits, with lab work and teledoc at a $0 copay. Outpatient surgery in a hospital is $100 per surgery, and inpatient hospitalization is $200 per admission. Both have chiropractic and acupuncture benefits at $15 per visit, up to 30 visits per member per plan year each. There is no pharmacy deductible for either plan, with retail drug copayments of $10 generic, $25 formulary brand, and $50 non-formulary brand. New effective 2024, members can get up to a 90-day supply of maintenance medications at a retail pharmacy for 3 times the retail copay. Mail order prescriptions are also available at 2 times the retail copay. Now let's review some additional programs available for the Access Plus and Trio plans. The Trio plan has a lower monthly premium than the Access Plus. The Trio network is a subset of the Access Plus network. In other words, all Trio doctors and facilities are in the Access Plus network, but not all doctors and facilities in the Access Plus network are available in the Trio network. Members can self-refer to a specialist for a $30 copay, but again, you must self-refer within your assigned IPA. If you self-refer to a specialist outside your assigned IPA, you will be responsible for 100% of the charges. Urgent and emergent care is available worldwide when traveling. Teledoc, virtual general medical, and behavioral health visits are available at a $0 copay, and both plans offer Wellvolution. New, effective 1/1/2024 to the Access Plus plan is Shield Concierge Customer Service. Shield Concierge, which prior to 2024 was only available on the Trio plan, is your total healthcare connection. One call to Shield Concierge connects you to a dedicated representative who can answer your questions and connect you to registered nurses, health coaches, pharmacy technicians, pharmacists, and/or social workers as needed when you need more, all in one call. Available only to Trio members is LifeSpring and Call the Car. LifeSpring provides chef-inspired, prepared, ready-to-heat meals delivered right to your door at no additional cost. You can choose a meal and snack plan that fits your dietary needs, including health-conscious, heart-conscious, diabetic, low-sodium, and renal diets. This program is only available to TRIO members who are determined to be eligible by a Blue Shield case manager. If you're eligible, the case manager will authorize the meal delivery service for you and then work with you to determine which meal and delivery plan works best for you. Call the Car is available to eligible members at no additional cost and can be used to get to and from medical appointments, dialysis centers, and other healthcare facilities as needed. Call the Car's modern fleet of vehicles are wheelchair and gurney accessible. Medical escorts offer door-through-door assistance, helping you from your home and into your location. This program is only available to TRIO members who are determined to be eligible by a Blue Shield case manager. If you're eligible, the case manager will authorize transportation support for you. Call the Car will then work with you to arrange transportation support at your convenience. To find out if you're eligible for either LifeSpring or Call the Car programs, or just to get additional information on either program, please call the Shield Concierge number on the back of your Blue Shield ID card. Let's talk a little about mental health support. Access Plus and TRIO members have access to Magellan's robust network of providers. Magellan has a network of over 16,000 providers in California, 12,000 of which have seen at least one SFHSS member. 10% are medical doctors, 66% are therapists, and 24% are applied behavioral analysis or ABA behavioral analysts. Most Magellan providers have digital access. They offer digital appointments, telebehavioral health, and virtual walk-in clinics. Access Plus and TRIO members also have access to Teladoc's behavioral health providers as well at a $0 copay. Magellan is always focused on recruiting specialty groups with innovative delivery methods to meet members' needs and improve access to care. A few of these programs include Foresight, which offers mental health and wellness clinics, providing members with a wide range of treatments and services related to improving mental health. NOCD, which is a digital behavioral health treatment for obsessive compulsive disorder using exposure response prevention therapy. Cerebral, which offers help for anxiety and depression via online provider visits, care counseling, and prescriptions delivered to your door. And finally, Caden, a technology-enabled behavioral health platform that's humanizing addiction recovery and therapy through easy-to-use, intuitive tools. Magellan offers immediate 24/7 access to licensed clinical staff and a clinical team who assesses urgent needs and connects members to the appropriate care. Triage and referral protocols designed to promote care continuity and coordination, as well as appointment assistance. The appointment assistance assists in appointment searches for members who have an immediate need and prioritized availability of providers who have committed to expanded availability. Access Plus and TRIO members can access mental health care by calling Magellan customer service at 877-263-9952. The Magellan representative will identify the member's needs, provide assistance walking the member through provider searches, generating at least 10 providers, and sending that listing to them via secure email, fax, or U.S. mail. Magellan representatives also encourage members to call back if they require further assistance and will also assist the member in locating an available appointment if needed. Thinking of starting a family? Blue Shield of California offers SFHSS qualified members pregnancy care, maternity care, and infertility treatment benefits. Access Plus and TRIO members can choose an OBGYN by asking their PCP for a referral or by accessing the Find a Doctor tool and locating an OBGYN accepting new patients within their medical group. Access Plus and TRIO members also have access to Maven. With Maven, you and your partner get access to virtual care for pregnancy, postpartum, and return to work after parental leave. You will enjoy 24/7 virtual access to care advocates, specialists, mental health support, and content tailored to your experience. During pregnancy, members have access to OBGYNs and doulas, birth planning, prenatal nutritionists, and miscarriage pregnancy loss support. Postpartum members have access to infant care education, pediatricians, lactation consultants, and infant sleep coaches. Once you're ready to return to work, members have access to back-to-work support, career coaching, and emotional support. To get additional information or to enroll in Maven, members would visit blueshieldca.com/Maven. Blue Shield of California also offers SFHSS qualified members infertility benefits. Single women and same-sex couples would access their benefits in the same manner being described. Access Plus and Trio members would access their infertility benefits by making an appointment with their PCP and requesting a referral to a reproductive specialist. Members can request multiple referrals within their medical group if they are not happy with the initial reproductive specialist referral. If a member would like a second opinion to a reproductive specialist outside of their medical group, the member would call the Shield Concierge number on the back of their ID card for assistance. Members are allowed one second opinion, one per diagnosis, in a calendar year. If you need help finding a reproductive specialist, members will need to contact their PCP and be referred. Members can also go to Find a Doctor to search for a reproductive specialist themselves to discuss with their PCP at the links provided on this slide. Members can narrow their search by gender and language by using the Filter and Sort feature after they've completed their search by name or specialty. If you need assistance in using the Find a Doctor tool, you can watch a quick video tutorial at blueshieldca.com/watch-find-a-doctor. This portion of the presentation is dedicated to managing a serious illness and advanced care directives. Palliative care is patient and family-centered care that focuses on quality of life. It eases the discomfort of serious illness by addressing the member's physical, emotional, social, and spiritual needs. Palliative care is appropriate at any stage of a serious illness and can be combined with ongoing curative treatments. What's available? Treatment decision and support, care plan development and shared decision-making, home-based palliative care visits, in person and via video conferencing, medical management and reconciliation, psychosocial support for mental, emotional, social, and spiritual well-being, 24/7 access to help and support, as well as caregiver support. Where is this support available? Throughout California, wherever the person needs or wants them. In the home, in clinics in many metropolitan areas, in many large hospitals, via phone or video in rural areas, and in many nursing homes. Who is available to support members? Doctors, nurses, social workers, chaplains, home health aides, and other specialists. If you'd like additional information regarding palliative care, you can visit blueshieldca.com/palliative care or call 800-393-6130. Hospice care is medical care for those who are experiencing life-limiting illnesses and care in their final stage of life with 6 months or less left of life. Care is typically centered in the home, but can also be in a hospital or extended care facility. Hospice is provided when there is no curative treatment being given for a serious illness. Instead, care involves support and managing symptoms. Comfort is the primary goal. Services are end of life for those who are seriously ill. The care team consists of physicians, nurses, social workers, home health aides, and chaplains. Locations can be in-home, hospital, skilled nursing, or extended care facilities. Support hours are regular visits and 24/7 telephonic support. There is no co-payment or co-insurance, and no prior authorizations are needed. Care goals are to improve quality of life and support the natural process of dying. If you'd like to get additional information regarding hospice care, you can call the Shield Concierge number on the back of your member ID card. No one likes to think about the end of their life, but there are ways to be prepared. Writing down your wishes on an advance directive when you're healthy is just as important as when you're sick. You never know when it may be needed. You may already have an idea of the treatment you'd want toward the end of your life. For instance, if you have a condition you are unlikely to recover from, or if you're in a coma with little or no chance of ever waking up. Without an advance directive, your medical team would typically consult with your nearest family member on treatment options if you were unable to communicate. Individual members of your family may disagree on what's best, or you may want another loved one who knows your wishes better to advocate for you. Without an advance directive, others may decide things on your behalf that you would not have chosen. Members can talk to their PCP or call Shield Concierge for assistance in completing an advance directive. Members can also go online and complete an advance directive themselves. Here are a couple of websites you can visit to start this advance directive process and get additional information regarding advance directives. The Conversation Project. The Conversation Project is dedicated to helping people talk about their wishes for end-of-life care. Prepare. Prepare is an interactive website that can help you identify your values and goals for medical care in the future. Centers for Disease Control and Prevention, or CDC. The CDC offers a variety of resources about advanced care planning and related issues. Coalition for Compassion Care of California, or CCCC. The CCCC provides online resources that can help you start the planning process and begin the conversation with others. In this section of the presentation, we're going to discuss managing chronic conditions. Access Plus and TRIO members have access to Shield Support Care, a comprehensive all-acuity care management program for chronic conditions that features member-focused clinical and self-management interventions. Members who are eligible for case management are identified using data-driven criteria based on authorizations, medical and pharmacy claims, and direct referrals. Members can also call the Shield Concierge number on the back of their ID card to request additional information about case management and/or ask if they qualify based on a current condition. Here are areas consistently being reviewed for possible case management: behavioral health, cancer, cardiovascular conditions, catastrophic injury, depression, diabetes, high-cost claims, LGBTQ health, musculoskeletal conditions, opioid use, pain management, respiratory conditions, stroke, transplant process, and recent ER utilization or hospital stays. Access Plus and TRIO members always have the right to a second opinion. Members can request a second opinion by contacting Shield Concierge at the number located on the back of their ID card. Members are allowed one second opinion per diagnosis each year. Access Plus and TRIO members also have both chiropractic and acupuncture benefits. Both are available at a $15 copay per visit, and members have up to 30 visits per member per plan year for each chiropractic and acupuncture services. Your well-being is extremely important, and Blue Shield of California and SFHSS have you covered. Wellvolution is a program offered to all Access Plus and TRIO members. Wellvolution is a platform that provides improved member access, convenience, experience, and efficiency by using virtual digital care point solutions to prevent, treat, and reverse disease. The digital and clinical programs and services will connect members to proven resources to manage and improve health through coaching, lifestyle medicine, meditation, and mental health support and counseling. There are 4 program categories. These programs have been vetted by Blue Shield of California and offer accessible apps based on the latest in science and lifestyle medicine to help members improve their health, and these programs are available to members at no additional cost. The 4 program categories are: number 1, stress, sleep, and resilience with apps like Headspace and Ginger. Number 2, tobacco cessation with nicotine replacement therapy, or NRT. Number 3, diabetes prevention programs, which is a CDC-approved 12-month program where enrolled members would receive coaching, a digital weight scale, and a Fitbit. And finally, number 4, condition-specific programs where enrolled members receive coaching and a digital weight scale. Enrolling is easy. All you need is access to a computer, tablet, or smartphone. Members can also call Wellvolution customer service at 866-671-9644. Instant chat and email are also available. Members would access Wellvolution at www.wellvolution.com. Members would then create an account with a password using their member ID on their ID card. Members would then answer a multiple choice questionnaire of about 10 to 15 questions to confirm their health goals and needs, and Wellvolution will match you with the providers you want or providers it recommends for you. If you don't get the providers you want, You can always go back and re-answer the questionnaire, slightly changing your responses until you get the providers you would like. Headspace offers guided meditations, sleep casts, music playlists for focus, sleep, and dance breaks. Headspace offers a library of 500 plus meditations on everything from stress, sleep, grief, resilience to compassion, tension releasing workouts, relaxing yoga, focus music playlists, and more. Meditations are guided and can be 3 minutes to more than 20 minutes, depending on what you need and what you choose. Headspace is available in 5 languages: Spanish, English, Portuguese, French, and German. If a member were to purchase Headspace, it would cost them $70 per year. Through Wellvolution, it's available at no cost. Wellvolution also includes a licensed clinical provider called Ginger. Ginger is an app-based mental health service provider. Behavioral health coaching offers members day-to-day support. The Ginger app includes a self-care library with interactive experiences that help members learn more about and practice the valuable skills needed to manage stress, anxiety, and other day-to-day challenges via guided meditations, breathing exercises, recorded classes, and more. This portion of Ginger is available to members at no additional cost. Licensed therapists work with members to deepen self-awareness, identify and address ineffective patterns of behavior, and process thoughts and feelings. Psychiatrists stand ready to support those in need of additional care, including prescribing medications. When a member accesses a licensed therapist or Ginger clinicians via virtual consult, their mental health copay of $25 per visit will apply. I don't want you to think that Wellvolution is only for members who have a condition or need help. If you're not overweight, do not smoke, do not wish to enroll in Headspace, or have a chronic condition, there are still wonderful resources and tools available once you register for Wellvolution. Once you've signed up for Wellvolution, you can access everyday choices via your dashboard, which contains exercise videos, health content, and a robust recipe library. Thank you for taking the time to attend this presentation. Should you have questions regarding this information or any other plan or benefit items, you can always access this information at www.blueshieldca.com/SFHSS or contact the Shield Concierge team. Thank you and have a great rest of your day.